I've got a bigger brain. I am the leader of this group. Super warrior. Ooh. So guys, this is the part 2 of things that can happen to the female body after childbirth. The VJJ might not be the way it was before you gave birth, before you got pregnant, and most women swear that their VJ is the same. I'm trying to say that the shape of the VJ might not be the same because it has gone through process during pregnancy and during labor and delivery, so the shape might not remain the same. It might be swollen few days or months after you give birth and then come back to the way it was before you got pregnant, or it might actually shrink. Some women do have shrinkage of the VJ after giving birth, while some women say that their VJ is tighter than it was before they got pregnant, and some say that it is wider than it was after they gave birth to their loved ones. Another thing that can happen is you can leak urine. So the medical term for this is urinary incontinence. While you are pregnant, so many things go on in your pelvic region. Pelvic region is technically the region, the area in your body where you have your pelvic organs such as the womb, otherwise known as the uterus, the ovary, the fallopian tube, the urinary bladder also, so the sac that holds your urine. And after birth, that area, the urinary bladder muscle, can be weak, and then a little force or ejection on the muscle might make you leak urine. Take for example, some women, when they sneeze, they leak urine. When they laugh intensively, they leak urine. When they jog, they leak urine. Motion sickness. So you might be wondering what that is. Motion when you're in motion, and sickness when you're sick. So when you are in a moving vehicle, train, airplane, whatever it is, as long as you're in something that is moving, you might start feeling sick, feeling dizziness, lightheadedness, and you can start vomiting. So most women do have this. This is also in regards to the hormones. Hormones play a lot in this human body. Another thing that we must talk about is forgetfulness, guys. Forgetfulness is a thing, and it is otherwise known as the mommy's brain. Can you remember those times that you think about what you have thought about that you should do, and then you cannot remember it? So think for example, you've planned your day. I'm going to the supermarket to buy this and that, toothpaste, roll-on, washing liquid, and when you get to the supermarket, you are remembering, you are thinking, what did I come here for? And this usually happens to our daily activities. We do not remember what we wanted to do, and some researchers have researched on this, and they say that women who have given birth have a bigger brain than they had when they were pregnant. I don't know if this research is true, but it's a win-win situation. Just think about it. Oh, I've got a bigger brain. I am wiser than before. Yeah, guys, it is a very serious thing. Another thing that we need to talk about is increase appetite. Increase appetite. So some of us, if not all of us, have experienced this either as soon as you give birth, or when you are breastfeeding, or after breastfeeding. We want to eat eat, 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 and I am the president of this group. I am the leader of this group. Yes, I said it with my full chest. I remember while breastfeeding my daughter, guys, this was around the 4th week or 6th week postpartum, and I literally would eat everything I come across, like every single thing. Usually I eat 2 times a day before I got pregnant, and while I was pregnant I started eating 3 times a day because I had to give nutrients to my baby. But after I gave birth, it is a must expedient that I should eat 3 times a day, and not just small regular meals. I'm talking about heap of meals. Like I could sit down and finish 8 slices of bread. I kid you not. This was how bad it was, and this is because I had increased appetite. Another thing that we should talk about is the diastasis recti. This is the separation of the abdominal muscle. So the muscle that is underneath your navel, muscle there separates while you are pregnant, while your body stretches to accommodate your baby. That muscle there separates, and this can cause what is known as the mommy pouch. So that is why when you are trying to lose weight, you're losing weight everywhere, but that area still remains the mommy pouch. That is what happens. So the next thing that can happen to the human body after giving birth is prolapse. So this is actually a complication, but some women do have this. While I was working in the hospital, women complain of this. So let me tell you what happens. Pelvic prolapse. Like I said earlier, we have what is called the pelvic region, the pelvic muscle, and muscles that wage or that supports the pelvic organs, and these pelvic organs are the womb, otherwise known as the uterus, the fallopian tubes, the ovary, the bladder, and the rectum. The rectum is technically where your poop passes through into your anal region, into your anal canal, into your anus. So all of these organs are supported by ligaments and muscles. So some women, when they give birth, they develop a condition that causes the muscle to get weakened. So this muscle gets weak, and because these muscles are weak, it will make these organs that I have listed to come through passages. So some women can have uterine prolapse, so womb prolapse. Prolapse technically is when something has prolapsed. When something has elapsed, when something is inside a place that it shouldn't be. Technically, I'm trying to explain it in a way that you guys will understand. So when someone have a uterine prolapse or a womb prolapse, the womb will go into the VJJ, and that can be so worrisome, and some women do experience that. And if any woman have the urinary bladder, so the bladder prolapse, the bladder will be entering into the opening, into the place where it's not meant to be. Likewise, the rectum will be entering the vagina, and this is sad that some women actually have this, and they need to get urgent help. If it's so bad, they can get urgent help. If it is not serious, they can do other things, the Kegel exercise, avoiding lifting heavy objects Avoid doing strenuous exercise that can weigh that place and make it to prolapse even more. Another thing that can happen to we women after childbirth is that whatever illness that might have happened or that might have surfaced during your pregnancy period might still be there for life. And I'm talking about diabetes, the gestational diabetes. This is diabetes that happened while you were pregnant. So usually occur at the second trimester of your pregnancy. And if you do not know what this is, it's technically sugar problem, the type 2. That is the insulin resistance. So we do not have enough insulin in our body. After you have given birth to your loved ones, it is supposed to disappear within 6 weeks. If it is still there, you have to be treated like a normal diabetic patient. And another illness that can happen during pregnancy that might not go away after childbirth is hypertension. So we have the pregnancy induced hypertension, so hypertension caused by pregnancy, and then it is meant to disappear 6 weeks after you have given birth, 6 weeks after you have your baby. But if after 6 weeks the blood pressure have not gone back to the way it was before pregnancy, you are supposed to remain on the antihypertensive medication, so medication that are being administered to people that have hypertension. Yeah, so these are the things we women suffer because we want to bring life into the world. We should see ourselves as super women, super warrior. We should be proud of ourselves that brought life into being, and it's so wonderful that we have the privilege to do this. Guys, we have come to the end of this video. I hope you enjoyed the video. If you did, please click the like button. Please subscribe to my channel. Please drop a comment. I would like to know in the comment section, women, let me know which of these you battled with, which of these you are still battling with in the comment section. Let us support ourselves. And please, guys, share this video, share it to your friends, your loved ones. Share it, guys. Let us grow our channel. Thank you so much for watching, and I will see you guys in my next video. Bye.